We're back with the Problem Solvers Health Alert this afternoon as the CDC is issuing a COVID-19 testing requirement for anyone entering the U.S. from China, as that country deals with a surge of new infections. So starting January 5th, everyone 2 years and older who is flying here will be required to test negative on a PCR or an antigen self-test 2 days before departure. Now, despite that, there is some good news back here in regard to the so-called Tripledemic in Colorado. Joining me now to discuss, Dr. Connie Price, Chief Medical Officer over at Denver Health. Dr. Price, good to see you. Thanks for being here.
Yeah, thank you.
Okay, let's start with the numbers on these cases. Tripledemic, we're talking RSV, flu, and COVID, and more so how full Denver Health and other hospitals are getting right now.
Well, we're seeing a decline in what we were seeing earlier when we were absolutely getting overwhelmed. And so we're seeing a bit of a reprieve, which is welcomed. And that reprieve is coming from all three of those? Yeah, pretty much. Cases have been stable for flu and COVID and decreasing for RSV. So okay.
What do you think is the cause of that? Everyone says that, around these holidays, they expect the boost after Thanksgiving, after Christmas, after Hanukkah, and then again after New Year's.
Well, we did see a surge after Thanksgiving, but since then we have seen a decline, and it is possible we'll see another surge after people have gathered, but it takes a bit to get those infections spreading again after people have been together.
Are you still seeing that, at least with COVID, a majority of the people, and I guess with the flu as well, who are in the hospital because of these viruses are not vaccinated?
Well, it's about half and half now with COVID anyway. So many of our patients aren't vaccinated, but there are people who are vaccinated that have been infected both with flu and COVID as well. So it's not 100% protective, but it does result in less severe disease in general when you look at it.
Absolutely. A lot of people are wondering, and I guess this question has been going around since the pandemic started, masking as a law or as a direct guideline from medical professionals. Do you think that's coming back anytime soon? Would you recommend it right now?
Well, I think we're getting into a new normal where this is just going to be a choice that people make if they're at increased risk or if they're having to have increased activity of these respiratory infections in their community, they will choose to mask. I see us going a little bit more away from mandates, but that's just my hunch.
Okay. Anything people should do besides get the vaccines? Just wash your hands, typical stuff?
Wash your hands, protect yourself, stay home if you're sick, don't spread to others, and you exercise your right to choose to mask or socially distance when warranted.
All right, Dr. Connie Price, Denver Health, good to see you.